Carmen.
Hello, my name is Carlos Joven. I'm a student nurse here to help you out today. Mind if I get your first and last name?
Angel Pena.
Wonderful. And I see here that you may have some allergies.
Yes, I'm allergic to penicillin.
I don't believe I asked you for your date of birth. Mind giving that to me, please?
3/15/85.
Wonderful. Now I have scheduled heparin here, 500 units, sub-Q daily at 1000 for you, Mr. Pena. Are you aware of that?
Yeah.
Okay. I do want to let you know that there are some side effects to heparin, such as bleeding and bruising. Knowing these side effects, would you like to continue with your medication today?
Yeah, that's fine.
All right, perfect. Now, before I leave, let me go ahead and check your platelet count and PTT time, and they are within normal ranges, which are 150 to 400,000 platelet count and 25 to 35 second PTT time. All right, I'll be right back, okay? So let me, hand hygiene. I want to educate you, okay? I want to make sure you know why we're going to give you this medication before I leave. Okay, Mr. Pena?
Okay.
Now, heparin is given to help prevent blood clots.
Oh, okay.
Right, okay. Do you know what those are?
Yeah.
All right, perfect. So I'll come back in a minute with your heparin. Hand hygiene out. Hand hygiene into the med room. Okay, I have Mr. Pena here, who's receiving heparin, 500 units sub-Q daily at 1000. Let me go ahead and start looking for the heparin. All right, here we go. We have heparin here for Mr. Pena, 500 units sub-Q, 1000. I'm going to go ahead and get the syringe, my needle. Get some alcohol. We are set. All right. Hand hygiene out of the med room. Hand hygiene back into this room. I'll go ahead and set these supplies down. Let me just go ahead and start preparing your med first. We'll get to doing that check in a minute. All right, let me get some gloves. My back away from. Alcohol pad. I'm gonna go ahead and wipe. All right, I'm gonna go ahead and pull away. And half a milliliter equates to the 500 units that I need to give, so I'm gonna have to make sure I inject that half a milliliter of air into the vial. I'm gonna go ahead and withdraw. There we are, perfectly, no bubbles. Now, grabbing this, and I'm gonna go ahead and do my third check. All right, mind repeating your first and last name?
Angel Pena.
Perfect, and I have your 500 units, which equates to half a mil of heparin. We're gonna administer it sub-Q at this time 1000. Now, where was the last side? What side of your abdomen was used last time for your heparin, Mr. Pena?
My right side.
All right, so we're gonna go ahead and use your left side today, okay?
Okay.
All right, so let me go ahead and get some gloves on. And I'm gonna go ahead and clean the right side of your abdomen. All right, go ahead and clean it. And you're gonna feel a little bit of a pinch, okay, Mr. Pena?
Okay.
And I'm gonna go ahead and pinch. Administer the med. Take the med out. Safety. Before I take a step, I'm gonna go ahead and throw that in the waste. All right. How are you feeling, Mr. Pena?
I'm okay.
Yeah? Okay. Now I'm gonna come back in about 2 hours to reassess for any bleeding or bruising. Okay, Mr. Pena?
Okay.
Anything else I'm forgetting before I leave? Make sure you think. I'm gonna go ahead and document before I go as well. Boom, boom, boom. All right. Hand hygiene out without my gloves on. And we're all set. Have a wonderful 2 hours before I come back.
Thank you.
Thank you.